Okay, so let's call the meeting to order for the Midstate REMSCO, January 28th, 2025. We stand for the pledge.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So let's go ahead and do our attendance. Yes, okay.
All right. Kathy Evil. Heather Bernard. Nick Capron. Kyle Cashel. Here. Cal Davidson.
Here.
Bill King. Here. Eric English. Here. Vinnie Ferrone. Here. Nat Help. Here. Jenna Illingworth.
Here.
Rick Irizarry. Here. Dennis Johnson.
Here.
Sue Camry.
Here.
Eric Merrill. Here. Jim Monahan. Here. John Murphy.
Here.
Leslie Myers. Rich Schnauer.
Here.
David Paddock.
Here.
Robert Paddock.
Here.
Chad Smith.
Here.
Josh Stagner.
Here.
Paul Taylor.
Here.
Joe Taylor.
Here.
Eric Townsend. Here. Andy Vanderwalker.
Here.
Bill Vinyl.
Here.
So Jared Waffle.
Here.
Jeremy Williams.
Here.
All right. Four associates. Dick Bishop.
Here.
Dan Brodell. Bob Clark.
Here.
Donnie Kane. Dr. Clement. John Melnick.
Here.
Anthony Scalise. Robert Stern at the third. And Emra. And guests. We have,
Royce Rawls, Buntry.
all right. And we have any other guests in the room? Getting there. And then we have Melissa Lockwood. We got distracted, door open.
Right.
All right, so
What?
did you mention that we have, I never know.
We have a quorum.
Thank you. All right, so tonight we have a CON conversion application that's been submitted to the ambulance committee. Paul's going to get into that. What I'd like to just mention kind of ahead of time is we do have a stenographer on. So we want to make sure that she knows who's talking. So when you talk, please say your name, say what you need to say, and then we'll keep going. That way she can kind of keep track of who's saying what. Also, during the vote, and Paul can mention this too if I don't do it justice, but keep in mind that the way the voting is going to go, it's either a yes or a no. If you abstain, it's still counted as a no vote. Okay, for the purposes of CONs, we have to have a majority of seated members voting in the affirmative for it to pass. So just if you need to abstain, then you need to abstain, but I just wanted to make that kind of understood that that's what the abstention means. It doesn't mean that the vote's not counted. It's just, it is counted. All right, I will turn the proceedings over to Paul Taylor, ambulance committee chair.
Okay, the ambulance committee has a
bringing forth a seconded motion to the council to approve the Madison County application for new ambulance service as required by New York State Public Health Law. Public need is, by the BEMS policy statement 06 is a demonstrated absence, reduced availability, or inadequate level of care in ambulance or emergency medical services available to a geographic area, which is not correctable through reallocation or improvement of the existing service. So we're bringing forth this as a seconded motion to the council to approve the application. The recommendation from the ambulance committee is to approve the Madison County application for new ambulance service. Based upon the review of the application, the public hearing, and the hearing officer report, along with submitted documents, the committee was able to find a demonstrated absence, reduced availability, or inadequate level of care in the absence of Madison County providing the ambulance service to this area. Now we have a seconded motion.
Okay. So this is procedural, so it's going to need to be a roll call vote. So again, the motion on the floor is to approve the conversion of Madison County ambulance from a muni CON to a full CON. So yes would be to approve, no means you do not want to vote to approve it, and abstention is when you don't want to vote. Is there anyone here that needs to express any conflict at this time? Okay, Jenna Illingworth is expressing a conflict. Jeremy, I understand the nature of Jenna's conflict, the nature of your conflict.
I'm an employee there.
Okay. In and of itself, I don't think necessarily constitutes a conflict. If you still, wish to not vote, that's up to you. Fortunately, there aren't other employees there.
So anybody that's really as district in the.
I'm sorry, excuse me, I don't mean to interrupt, but I don't see who's speaking and I don't know their name.
Bill Vinyl.
So just for clarification, obviously that overlaps my territory. So I should not be voting on this, correct?
I don't know. I don't think
No,
that's.
I think the only thing that should it might preclude, but the way I understand it is, the only thing that should preclude somebody from voting is somebody who is an owner, operator, has a vested interest in the organization.
In that organization.
Yes.
So,
Such as if it was a vote on an AmCare ambulance vote, I could not vote. But an employee of mine could vote.
Well, it's Eric Merrill talking. I agree with Bill. I mean, I'm the director of an ambulance service that borders, the county. So I don't feel it's fair that I should be, why does if we abstain from voting, why does it make a no vote?
Okay, I can explain that.
But Paul, I'm sorry. I'm having a hard time hearing the gentleman that before you that spoke.
He wanted to know why an abstention was considered a no vote. An abstention is actually considered a no vote because you have a group of 30 seated, and there has to be a majority of the seated members to vote in the affirmative to pass a motion, to have a vote. An abstention actually counts as a no vote because you need 16 affirmative votes to pass a motion or a seconded motion coming. So let's say that we've got 30 people and we've got 16 of them are in some way related to or feel as though they have a conflict, so they're going to abstain. There still needs to be 16 votes to pass, whether we had 14 people abstain or not. So therefore, if there wasn't enough people to reach the 16 threshold, it would not pass. It would fail. Correct?
Yeah, so look at it this way. We're not,
I'm sorry.
the question, oh, this is Vinnie Ferrone, Faraone. So the question is not whether you want Madison County ambulance or not. The question on the table is to approve Madison County. So all that's required to answer that question is a yes to approve it. An abstention just knocks out one of those yes votes. So we're not voting on it's not a yes or no question, the question is to approve it. So we're voting yes to approve it. We're not voting no to approve it, we're voting yes to approve it. That's what we're looking for, 16 yes votes. So if you don't vote, it's a no vote. It's not really a no and no vote, it's just a non-vote because we have to have 16 yeses. Right, so that's how, it's a little bit complicated, but that's the way the law is. It has to be 16 yeses. So if we conflict, now listen, I'm the poster child. I'm not a fan of municipal CONs, but this has to pass because the county needs Madison County ambulance. So if everybody conflicts themselves out, then it's not gonna pass and there will be no ambulance service in Madison County. So we have to, I would encourage you to just vote yes, not worry about being conflicted out. Jenna, you probably can conflict yourself out, and you probably don't even have to, but you probably should just to be on the safe side. You know what I mean? That's probably just be safe. I don't really think you need to. And Stefan, Eric definitely doesn't have to, because you don't have a pecuniary interest in that company,
That's right.
right? So, but vote as you want, but that's.
The way I understand it, this is Chad Smith, the way I understand it is, if your yes vote is going to financially benefit you, you're gonna make money off from Madison County getting their ambulance and not by salary,
Directly.
directly. Let me just read this excerpt from, this is the letter, as part of 0606, New York State policy statement. It says, in order for a motion or resolution to be passed, it must be approved by not less than a majority of whole number of members authorized to vote, not just those members present at the meeting. And that comes from GC law, section 41 is what's referenced in here. So it says, if a board is authorized to contain 30 members and 16 are actually present, there is sufficient attendance to constitute a quorum and business may be conducted. However, any issue which did not receive the vote of every one of those 16 members would then fail because the minimum vote needed to pass the resolution is 16. That help clarify?
I know it sounds muddy, but I mean, let's talk about it. But it sounds muddy, but that's what we've gotten from the councils of the DOH. Previously, many decisions ago, long before Utica, long before any of the other actions that we have taken place on. If there's 30 people seated, you need 16 to pass.
I think it's still immaterial, I guess, but I don't have a problem with that, and I agree with Madison County.
Sorry, who's speaking?
Bill Vinyl. I think just a matter of formality and the way things were done in the past, and say, I've been here a few years. And it would seem to me that when Utica fired theirs, I believe Jack Kunkel had to abstain.
Correct, Jack did, but, Vinnie Ferronia, yeah, only Jack Kunkel abstained, I didn't abstain,
No,
and I was an employee.
right. But that's not, the question I asked, do I need to abstain?
Well, you're not gonna gain anything, well.
I understand, I know that.
You have, but you have.
You're the Jack, we're gaining
Right.
nothing, you're losing.
I don't know.
As long as-
I guess just you,
I know.
Everybody can absolutely vote yes, vote no, or abstain, absolutely. It's just understanding the process that there has to be 16 affirmatives to pass. And if there isn't, then it doesn't pass. It doesn't matter if they voted no or they abstained. 16 was not obtained for yes vote. Just so everybody understands that, that's all. I mean, please abstain or vote whichever way you would like. Understanding that if everybody abstained, it will not pass.
We got 4 absentee people. Are not voting, obviously.
Right. Any other discussion? Okay, we'll call the vote.
Kyle Cashel,
Yes.
Hale Davidson,
Yes.
Sorry, make sure to speak loud. That wasn't a dig at you, Kyle. But please make sure to speak up. The speaker's way down here, so I want to make sure that she can hear.
Bill DeKing. Yes. Eric
I'm sorry, I
English,
didn't get, wait, I didn't get the last name, please.
Bill DeKing. Yes. Eric English,
Yes.
Vinnie Ferone,
Yes.
Nat Held,
Yes.
Jenna Illingworth,
I have to abstain.
Rick Irizarry,
Yes.
Dennis Johnson,
Yes.
Sue Cal Murray,
Yes.
Eric Merrill. I'm abstaining from the vote. Jim Monahan,
Yes.
Sean Murphy,
No.
Rich Nauer,
Yes.
David Paddock,
Yes.
Robert Paddock,
Yes.
Chad Smith,
Yes.
Josh Stagner,
Yes.
Paul Taylor,
Yes.
Joe Taylor,
Yes.
Eric Townsend,
Yes.
Andy Vanderwalker,
Yes.
Bill Vinyl,
Yes.
Ryan Ward, yes. Jared Waffle,
Yes.
and Jeremy Williams.
Yes.
Alright. Definitely have a yes vote.
23.
22. 22 yes.
Okay, so with 22 yes votes, the motion passes. Anything else we need from Stella?
No, that was it.
Stella, do you have anything else you need from us?
No, Jared, I'll email you what I need though, okay?
All right, sounds good.
Okay,
Thank
you
you.
very much.
Bye-bye.
Okay, let's continue on with the secretary's report.
So we got, some correspondence in, some holiday, seasonal cards. We got one from LifeNet. One from the Community Foundation. One from University of Rochester. And then we got a, thank you, for celebration of the 6-year anniversary for Edwards from Gary Edward. There.
Last month's meeting minutes. Minutes from last month's meeting. They get sent out?
They did
Okay.
this afternoon. An oversight on my part. I apologize.
So last month's meeting minutes got sent out a little bit late. Anybody?
I'll make a motion to approve.
Okay. Motion on the floor to approve.
I'll second.
Second. All in favor? All right. Any opposed? Motion passes. Treasurer's report.
All right, so account balances, we've got $5,664.14 in the savings account. $5 in each savings account for each checking account, The fundraising account had $4,250.11. The general account has $20,339.27. The opioid account has $9,436.69. And the state account has $10,133.77 for a grand total of $49,843.98.
Any questions on the treasurer's report? We'll take a motion to accept.
I'll make the motion.
Second,
Second.
all in favor? Any opposed? Any bills?
Bills, yes. So we gotta, pay Dr. Black, his second half of the medical director, which is $5,000 even. And then we gotta pay all of our stuff that we paid to MVHS, which is the rent, which is $3,370.48. Office supplies and paper, which totals $600. And cable, phone, internet, etc., which is $200.
So the check going to MVHS Education is for a grand total of $4,170.48.
Correct.
Questions? Need a motion to pay the bills? Jared, second? Sarah, all in favor? Any opposed? Carries. We do have a guest from Boundtree. JJ, I'll let you introduce him to the group.
Everybody, we have Brace Rowles from Boundtree to discuss purchasing consortia for United Huckleberry, Madison County. It'll be sponsored through Midstate, not Midstate, REMSCO.
Good evening, everybody. Thanks for having me. I'm gonna keep it short and sweet. Joe and I were talking about this at a recent visit, about kind of a sort of a group purchasing opportunity for the region. So where we can, kind of set some level pricing across all the agencies. So the agencies, the larger agencies that are currently getting better pricing now because of their volume, that would translate down to the smaller agencies that, you know, don't currently buy a lot from us. So it doesn't really change anything. There's no burden to the region on this. Essentially, it's reaching out to myself. I may not be your account manager. There is an inside rep named Darren, but for all intents and purposes, you can coordinate through me. And for any agency that's interested in participating, we'll make sure that all agencies within the 3-county region are set at a certain level. And again, that's kind of a foundational pricing. As I told the executive committee, obviously for capital purchases, anything like that, please feel free to reach out to myself, or if Darren is your rep, to Darren, and, you know, we work those things a little bit of a one-off sort of thing, right? It's hard to quote video laryngoscope for all these entities when not every entity will need that, right? But as far as your standard disposables, everything you use every day, that's a very easy process for us to do. So happy to do that for the region as a whole so that everybody can benefit. You know, all the folks that have been getting great pricing for years will translate down to the super small entities where maybe they spend a few $100s with us a year, or it's an AED every couple of years, that sort of thing. So really, again, no burden or anything on anybody other than I have a bunch of cards up here. If you don't grab one, I know somebody here can connect you with me, and I'm happy to make sure that your account is squared up. If you don't have an account with Boundtree, we'll get you set up. Did I miss anything? Is there anything you guys would like me to add?
Other than everybody understands it is not going to be mutual and exclusive. You can still buy from other people if you want, but opening it up to 3 counties and all the providers in those counties will be able to lower the base cost. So if you want to buy something from Boundtree, you get it at a better price.
Correct.
But you can still buy from anybody else that you traditionally have in the past. So it's not exclusive, but it's a good deal
We'd love to have
for
business.
everybody.
Yeah, I'd love to have your business, but at the end of the day, you know, there are obviously vendors out there that can, you know, beat us in certain areas and, you know, continue your daily business. But if I can help you out, please grab a card or connect with, pretty much any one of the leaders here and get a hold of me. Any other questions? Appreciate your time.
Thank you.
Thank you, Bryce. So anybody that, sitting at the table that's in charge of an agency that wants to do that, like you said, just get a hold of him. Any of you that work for somebody who's not here, bring it up to them. We'll be putting it out, in an email, and then we'll also be posting it on the website. And I think it's not too much to ask for the county coordinators to, maybe put something out to their agencies as well, to, reach out to Bryce and get more information about it. So just the, what I understand, just the 3 county region, Herkimer, Oneida, Madison County agencies. Committee reports, executive committee met, but nothing actionable. Ambulance committee has already done theirs. Paul, anything else for ambulance committee?
We have had a resurrected request for starting the process of a clarification of territory for Star Ambulance again. I have reached out to the director of Star on Friday, and she indicated that she would be starting the process again, following through with the clarification of territory. If you remember, 2 years ago, we made 5 requests for clarifications. We got 2 of them completed and 3 were not. This was one of the 3 that was not, that she is going to be starting that process again, so I understand. In preparation for a possible transfer of operating authority of Star to another entity. So they have to go through that process, and we're starting that again. More to come.
Questions for Paul? Bob, education?
So the education committee met earlier this evening and we discussed a few items. First of all, we had an update on most recent state meetings from both Ryan and Jared. We also reviewed the slate of classes that's going on right now, as well as those that will be over the summer and into the fall. And we feel that the 3 county region is being serviced well by the availability of classes. Most of the classes are either full or very close to full, and they're geographically spread out so that most students would have a short commute to one of our classes. And under old business, I think next will be the bylaw committee. We do have a bylaw change that we have proposed that I believe we'll be voting on tonight. And we anticipate our next meeting being in March.
Bob? You're up.
Last meeting, in November, we put the bylaws up on the overhead. We also passed out enough, copies for everybody. These are bylaws. Our bylaw committee also met prior to this meeting. And at last meeting, there was a seconded vote, or excuse me, a seconded motion that will go for a vote tonight to vote these bylaws into place. These bylaws, if anybody doesn't have them in front of them right now, they affect only the education committee. And they were put out there and they were put together very well by Bob. This is the top is what was there, and the bottom is, I don't know if I can do that, what they wanted to change it to. And all it was clarification on things like when they were gonna meet and how big their committee is. Does anybody want me to read the whole thing? Because apparently we can't, I can, and I don't mind. If somebody wants me to read everything, I will read everything. Show of hands. It's something, all right? I am being very sincere in the fact that it really just affects the
ambulance, or excuse me, the education committee and the way that they do business. So we're gonna have a vote. Is it gonna be just a, I think it's just a.
Procedural.
Okay.
Okay, any discussion? As he may have already asked for, but I'm talking to somebody else, apologize. Okay, so if no other discussion, we'll go ahead and call the roll.
Kyle Cashel,
Yes.
Cal Davidson,
Yes.
Bill DeKing,
Yes.
Eric English,
Yes.
Vinnie Ferrum,
Yes.
Nat Held,
Yes.
Jenna Illingworth,
Yes.
Ricky Rosari,
Yes.
Dennis Johnson,
Yes.
Sue Cat Murray,
Yes.
Eric Merrill,
Yes.
Jim Monahan,
Yes.
Sean Murphy,
Yes.
Rich Nauer,
Yes.
David Paddock,
Yes.
Robert Paddock,
Yes.
Chad Smith,
Yes.
Josh Stagner,
Yes.
Paul Taylor,
Yes.
Joe Taylor,
Yes.
Eric Townsend,
Yes.
Andy Vanderwalker,
Yes.
Bill Vinyl,
Yes.
Yes, Jared Waffle,
Yes.
and Jeremy Williams.
Yes.
I'm gonna go with motion passes.
Oh, yes.
We'll get those added, and I believe any change to bylaw needs to go out to the state to be approved, which they usually are good with that, and then make sure that they're updated. All right, Eric English, any membership committee news?
I have nothing, thank you.
Okay, thank you. Benny, anything from legislative?
The only thing from I don't have anything for this evening for legislative. The governor's budget just came out and, we are, mentioned, a lot in the governor's budget. They're proposing some changes to, Article 30. I just got them, so I haven't drilled down on them yet. So next month, after we have some legislative committee meetings at the state level, I should have some more information for this committee.
Vinny, there is a summarized version of it on Boardable that I can download and send out to everybody. If you guys want to look at it
That would be
ahead of
helpful,
time.
yeah. It's 14 pages.
Most of it's under part R. And then like just one section under part O and one under part B.
Don Hudson summarized.
Yeah, he did a great job. Okay, any questions for Rich? Okay, we're gonna update our programs to mention that Jenna Illingsworth is now there's no S in there, it's just Illingworth, sorry. Is now the committee chair for public relations, and I'd like to thank Vinnie for his many years of hard work on that committee.
Thank God. Thank God. Thank God.
Jen, any news?
So we did meet when Vinny was still chair. We talked about, doing a golf outing to raise some funding. Jared has secured the date and the venue. We're working on getting flyers made up and, getting some sponsorship. So more to come with that. We will be holding another meeting. So I literally just got the turnover from Vinny and he gave me the, here you go, and we're off to the races. We're also working on Fall Forum as well. So we're pretty well
Yes.
on the run with that. We've done a really good job with that.
Fall Forum is scheduled for September 19th, 29th, 19th. Our keynote speaker is going to be, Ian Casey, who's the director of health for Vermont. And he's also going to be doing a lecture on opioids, which allows us to use some of our opioid money to pay him. And Bob McKenzie coming down to do an Amish training. We have a medical director panel. Ryan Ward's doing BLS 12 leads, which is going to be a hands-on lecture, and then Dr. Glenn is going to do a PG ALS lecture, interpretation lecture. So pretty far forward on that. Golf outing is going to be August 17th, the Sunday at Barker Brook. So I should have flyers hopefully by the next meeting, so we can start looking for full sponsors, donations. The owner of Barker Brook, I work pretty well with. He is going to help us out in some ways. I mean, he gives my fire department quite a bit, each year. So he was thrilled. He's very pro EMS, pro fire. So he's gonna help us out in any way that he can.
Jared, where's the fall forum gonna be again?
Park Hill.
Harts Hill. Okay.
I have a question.
Sure,
Do you have a date for that, golf tournament? I know it's tentative, but
August 17th.
August 17th.
Yeah, it's a Sunday. All the Saturdays were picked over.
So we'll probably schedule another meeting to get more together and more announcements to come.
The sign up for fall forum that's gonna go out, I'm assuming a little too soon yet. But,
We have to save the date. We sent that out,
right,
to all the ALS bar transporting agencies. And John has it to put out to every Madison County agencies. And I get something over to Al, but.
you
We
guys
will
have an attendance cost or
We're working on trying to get sponsorships
registration fee?
prior to get the registration fees covered,
Okay,
or at least a minimum payment. So that's what we're working on now, is getting sponsorships for, the fall forum in general, and then doing vendor sponsorships as well, to hopefully get the cost down for members to be zero or very little. That's what we're working on now.
And that was September.
4919.
It's the 19th.
Any other questions? The finance committee?
Nothing currently, but we're gonna have to probably meet before the next REMSCO. We gotta get everything in line for budget and the annual meeting in May, so we'll probably meet before February's REMSCO. To get everything lined.
Any questions for finance? Safety?
Nothing for safety. And then SISM, we've had 2 debriefings since our last meeting in December.
Great. So, REMAC,
So not much out of the REMAC meeting last week. We went kind of quick. We do have a second motion to come forward. Dr. Black's bringing it as a policy statement, but it can go under an advisory. So it's transport of dialysis patients. Patients presenting in stable condition with history of hemodialysis and peritoneal dialysis are only to be transported to dialysis capable facilities. This applies even if the chief complaint of the patient is not directly related to dialysis. Community hospitals without dialysis do not have the capacity to care for these patients. Delays in secondary transfers and other logistical decisions due to these limitations have led to poor outcomes. If a patient/family or proxy is refusing transport to a dialysis capable facility, the medical control should be contacted to discuss directly with that patient, family, or proxy. If they continue to refuse transport to an appropriate facility after discussing with med control, a written signature refusal should be obtained in the medical record. If a dialysis patient has critical instability that requires immediate stabilization at the closest facility, then proceed as per the collaborative protocols for that critical emergency with appropriate medical control notification of the emergency needed.
Any discussion?
The only thing I would add to that for providers is which hospitals have dialysis. So it's not, hey, do they have it?
Is that
Oh, I
something
thought you
that
had
is
it.
or can be listed in Pulsera?
Yes.
I think the concept is good, but I think it's kind of foolish. So somebody with a cut, you can't bring to a local hospital, you gotta bring them to a dialysis center. That's
Well-
cool.
Much like when hospitals go on diversion, it's patient demand is patient demand.
Well, that's not what this says.
Has legal looked at this?
No, we don't have a legal.
I would have legal.
But as far as an advisory goes versus a policy statement, I think it needs to be more of an advisory than a policy statement. That's just my opinion.
Cause it does say in there, if they refuse, then you have to obtain medical or a refusal form.
Right.
Cause we,
So then we refuse to sign that too.
then you document it in your narrative.
I just, as I said, I think that it's kind of foolish that you can't bring a patient with a laceration to a hospital that doesn't have dialysis. That's stupid.
I think,
I get it if there's possibilities of them being admitted or, something like that. I get that 100%, but.
I think where the
We
problem
gotta have
lies,
enough common sense that they're trusting us to give drugs, but they won't trust us to make a judgment out here.
Right.
and it's not, Bill, it's not that, it's when the wind was on diversion. Over the last couple of weeks, patients were getting pushed to Oneida and Rome. Which some of them were dialysis issues. And they had nowhere else to go. Which we have to remember, diversion doesn't mean that they're closed. They
Try
still-
talking to the hospitals and tell them.
I understand that's education. I've had this conversation with the administration at the WIN because there was an issue with an agency that was bringing a unstable dialysis patient to them. And they still refused the patient, even though I called and they had a bed set up for them in the ER. Charge nurse still refused the patient. So there needs to be education, not only to the providers, but also to the hospitals. The only way a hospital can refuse a patient is if they are on closure. Correct, Melissa?
Yeah.
A couple of years ago, I had a hospital try to refuse to accept a cardiac arrest. And I was like, sorry, I'm in Oneida Deposit, you were getting this cardiac arrest, what are you here now?
I mean, the big question you have to ask, and you see this a lot in false error, is, and I'm not gonna mention any hospital, but you'd say you're bringing a patient, and they just needs to go to this facility. My question always to them is, are you refusing the patient? Because when they say yes, it's an MTOL violation, and then we start to process the violation.
Jeremy, a patient in cardiac arrest is a patient in extremis, and they should still take that patient.
I think that's where this whole advisory came from, was from the wind being on diversion.
They have designated nephrology on call. Just because you're a dialysis center doesn't mean you have nephrology on call. Well, how we determine that?
That would be hospital administration updating it on Pulsara. Can we get them to do that?
Pulsar does not get updated.
I'm aware. The only one that does is Oneida.
Yeah.
So I'm asking them the question, do they have a designated nephrologist on call 24/7?
I'd have to look.
I don't think they've been around with the same news.
I'd have to ask that question.
Then that becomes a question of.
May I suggest you ask these questions you have a breakfast meeting coming up with the WIN? Yes?
We do?
Yes.
Yes.
You know it. I sent it out to all the agencies.
I was at the REMAC meeting, and Dr. Black's point is that most of the ill patients that are dialysis patients that get admitted to the hospital, not for laceration, get admitted. And that's where the problem becomes. They don't have the capability of doing dialysis the next morning or 2 days later or whatever. That was his point. So I think that communication is the key here. I mean, I think that the conversation can be had. You know, listen, it's just a laceration. The patient's alert oriented, needs a laceration repair, and then it's gonna go back to the nursing home or wherever they came from. Versus, this person is not well and probably gonna get admitted.
I agree.
You know, it's just saying, we have to have that conversation. Doesn't it say, doesn't it say with consultation? I mean, that was what I really pushed to that discussion at night, was that we should be talking to the doctor who was going to take care of this patient.
First of all, you don't talk to the doctor. Yeah, wait,
Well,
make it the word clear.
Well, how, I guess the thing is too, you know, how do we know if the doctor has med control, authority? I mean, we do a community memorial, you know, we can't take orders from, staff at community memorial.
this is not, I don't see this as medical control. I see this as an advice from the physician at that facility, whether he can or cannot handle that patient. And we don't have to take his advice, but, I think we should have the conversation and explain, it's just a laceration, the patient's fine. Or this patient is sick, I don't know what's wrong with them, they're in CHF or whatever, they're probably gonna get admitted. According to Dr. Black, almost all of them get admitted. The ill patients that go to, dialysis patients, and that was his reasoning for this.
So if my patient's insisting on going to Hamilton Hospital, I can call the PA that's on.
Yeah,
duty.
my point in that conversation was, you call,
Yeah, so, but Vinny's saying it's whoever the provider's on.
So what I'm-
you have to make that decision.
So what I'm saying is, as patient care advocates, we should be making our best effort to convince the patient that that's not a good destination, or just like we would with a trauma, right, or a cardiac patient. Right? We should just make that effort, say, listen, you're probably gonna get shipped because they can't give you your dialysis tomorrow. If they refuse, then I think we should call that receiving facility and have that person or then back up our conversation with the patient. Sometimes the patient's family look at us, oh, you're just EMTs. When someone from the hospital says, we can't take care of you here, that sometimes changes their mind. That's all I think that I'm suggesting that this should be about, but I don't know.
But that's not what this says.
So,
This teeters on an Impala violation.
Are only to be transported. That's just how it reads.
Correct.
so the options that we have right now, this is a second in motion from the REMAC. Our options are, we vote on it, straight up or down, either yes, we approve it, no, we don't. Or I take a motion, we table it for 30 days. And next month's meeting, we can have Dr. Black on video to answer questions, amend the statement, withdraw the second in motion, whatever he chooses to do at that point. But since he's not here or online right now, kind of hard for him to.
I like that option.
That's a good idea. I'll make that motion. I'll make that motion to table it until Dr. Black can give us some more information.
Okay,
I'll take it a step further and say, I want somebody from nephrology from the win here then.
Or we can verify if they have 24/7 coverage, right? I think that's the thing that Jared could probably do to verify that they do have that coverage.
Again, but.
so on a side note, if the WIN doesn't have 24/7 nephrology coverage, then the patients don't go to the WIN, they go to
Syracuse.
So all dialysis patients.
That's not
need to
the
go.
point of this. The
That-
point of
I
this is the
understand that,
patient's
but
gonna get dialysis during their
I'm
stay.
just trying to get clarification on what that point is about.
If you have a nephrologist in the building, nobody's gonna hook that. I'm not hooking them up to a dialysis machine.
The point is, these people often, per Dr. Black, I'm just parroting what he said. These patients often need dialysis during their stay, not their ED stay. But he says most of these patients get admitted and they need dialysis the next day or 2 days later. And they have to be transferred to get the dialysis. This was his point. Again, there's a motion on the table to have him come and present.
Just vote on the motion on the floor. Send it back. If they're gonna be, admitted, that's fine, but I mean, we should have a little bit of anytime maybe we can.
The majority of times patients that are get admitted are going to present in extremis.
Agreed.
So then what do you do?
Why
don't we wait
They're gonna have unstable vital signs.
wait until Dr. Black comes
So there's a motion on the table, there's a motion on the floor to table this second in motion.
For clarification.
We have a second. Is there any more discussion on tabling the motion?
Yeah, I just think that having Dr. Black here to explain it would be good, but I think also having a representative of the WIN to confirm that nephrology is available 24/7 is important too.
All in favor, tabling the motion? Alright, any opposed? Okay. Motion will be on the table until it is removed. Okay, anything else for me, Mac? Okay. Medical coordinator report?
Sure, we'll start with enforcements first. Ramapo Valley Ambulance Corps, Agency Code 4319. Violations of Article 3012, 1F, 1B, 1B. Part A under dot 21J and A, they were revoked 10/17/24. Corona Community Ambulance Corps, Agency Code 7344, violations of Article 3012, 1F, revoked 12/2/24. John Kiefer, EMT number 220841. Violations of Part 800.16A2, 800.16A3, revoked 12/9/24, assessed civil penalty of $2,000. Christopher Pylock, EMT number 167410, violations of Part 800.16A1. Suspended for 1 year effective 11/22. Suspension is stayed pending successful completion of. Kadisha Garcia, EMT number 482007. Violations of Part 800.16A1, 2, 3, 9, and 11. Suspended for 1 year effective 11/26. Suspension is stayed pending successful completion of 3 years probation. Assessed civil penalty of $12,000. Of that, $8,000 shall be stayed pending no further violations. Stephen Stinson, EMT number 433772. Part 800.16A1, 2. Suspended for 1 year. Suspension is stayed pending successful completion of 3 years probation. Assessed penalty of $4,000. $2,000 is stayed. Carol Otar, EMT number 468572, violation of Part 800.16A1, 2, 3, 9, and 11. Suspended for 1 year, effective 11/16. Suspension stayed. Assessed civil penalty of $12,000. Of that, $10,000 is stayed. Lindell Brunson, EMT number 165731, violations of 800.3AN, 800.15B. Subject to completion of 3 years probation, effective 1/6/25, assessed civil penalty of $2,000. Empress Ambulance Service, Agency Code 5930. Violations of Part 800.21A, B, and N, 200.22H, 800.23AF, 800.24B4 and B6, subject to completion of 3 years probation. Arena Mortison, EMT number 497785. Correction, 449785. Violations of Part 800.15A1, 800.15A2, 800.3AM, and 800.3AL. Revoked 1/17/25. Revocation is stayed pending successful completion of a paramedic refresher within 24 months. 3 year probationary period, $2,000 assessable penalty. James Kozak, EMT number 155805. Violations of Part 800.3AM, 800.3AO, and 800.15A. Certification is revoked. Revocation shall be stayed contingent upon completion of a 1 year suspension and no further violations of Public Health Law, Article 30 or Part 800 for a period of 3 years. Assessed civil penalty of $2,000. Right now, the REMSCO budget is caught up. We just got the Q4 payment not that long ago. We do have to start Q1 and Q2 for 2024, 2025. There are some pre-qualifications that Eric has been working on that we just need to get finished up. They should go pretty quick. There's no budget modifications for either of those 2 quarters. We already talked about fall forum, the golf outing. We're still continuing to assist agencies with their renewals. NARC license and the NARC reports. NARC reports seem to be coming in fairly decent. I do have stragglers every month. The hospital is always threatening to take away their NARCs, but at this point they have not done that yet, which is probably a good thing. There were some issues with the pharmacy. They started to get some boxes that had used needles still stuck in the empty vials, which caused a lot of problems. We did have a couple providers try to get into the back of the pharmacy because they wanted to take a look at it. That was a big issue. There were some issues with, their NARC boxes with, you know, medications expiring 30 days after getting them. So I've been trying to work with Chris Hool. So when you guys get your NARC boxes, your meds aren't expiring within 30 days of getting them. So there have been some issues over the past few months at the wind. We try to address them. You know, myself and Jim and John have been down there countless times. You know, making phone calls, sometimes middle of the night, early morning hours. There was an issue where hospital beds were placed in EMS triage area and then agencies take the patients off their stretchers and put them on hospital beds and tell them to pretty much sit there until the room opened up. One agency reached out to me about that, and it was addressed within probably 10 minutes of that issue. That is a complete violation. That should not happen. As soon as you put your patient in some sort of hospital property or across that threshold, that is their patient. So that was a big issue. We've looked at their surge plan. I think there needs to be a little bit more work with the surge plan. Jim did have a meeting with some of the higher ups at the hospital. So we'll try and fix this issue. I know over the last couple of weeks hasn't been terrible. Like I said, I'm still getting those offload time reports every single day. Yesterday, I think I want to say the max wait was about 40 minutes, which is doable compared to 3-4 hours. So we're getting there. Paul brought up some good things in the REMAC, some studies that may help if we can get the administration and all the hospitals to really listen to us, you know, like discharging our patients at 7 o'clock in the morning compared to 3 o'clock in the afternoon. So now we've had 4 QAs since the last meeting, all of which were handled at the agency level.
I just want to echo what Jared said, but I want to personally thank the 3 of you guys. It's not your job to go into the hospital and help enact a surge plan. It is not your job to show charge nurses or administration how they need to move patients so we can get ambulances freed up again. That is not the clinical coordinator's job. That is not the EMS coordinator's job. That is not the program agency coordinator's job. But the 3 of them stepped up, and they've been doing it 24/7 for 4 or 5 weeks. You may not see it in the field, but you guys got to know that when they're stacked at the win, one of these 3 guys is getting called in the middle of the night, and they're going there and physically moving patients around to help get ambulances freed up. Doesn't happen immediately, but I know these guys are working their asses off to do it. And I, for one, am very appreciative of you guys doing this, because if Utica gets backed up, we all know what happens to the 3 counties. So thank you very much. It's not part of your job, but it's very much appreciated. Thank you.
Thank you. Any other questions, Jared, or comments? Program?
Lynn will be holding their EMS forum February 7th from 9 to 10:30 in the auditorium at the Wynn. All providers are encouraged to attend. It is on the website and we put it on the Facebook page too. We don't have the contract yet. It's still going through the process. Our quarters 2, 3, and 4 of 23 and 24 got rejected yet again. First we had a problem with the rent payments. We've corrected that. And now they rejected it because they didn't like the payroll for the 2 positions. They want pay stubs. So we're going through a whole process of what the bank will provide that they'll accept. They said that they wouldn't take what the MVHS provides them to print out for the ACH payments. And then effective January 1st,
We will also have to submit a time card report due to one of their internal audit findings. So we'll have to start that process. They said our reports from this payroll system should work fine for that. So we're working with Charlotte on VHS to get that straightened away so we can get those 3 quarters submitted.
Any questions for John?
So, part of that not having contracts, we were supposed to get money to fund paramedic students. We were also supposed to get money for recruitment and retention. We still haven't seen those deliverables. We're not going to see those deliverables till we get contracts. So, by the end of our first contract period, we're gonna miss out on paying for 3 to 4 paramedic students because that money's not spent, we lose it. So, I mean, I talked with Senator Griffo. Griffo reached out to, Department of Budgets, and we're still at a standstill. Multiple different senators from throughout New York State have reached out, and it's still, they're in the process of that approval. We have no idea when that contract is going to be approved. Or the amount, we can't even start a budget, because we have no idea.
Any other questions? Melissa, anything you want to mention from Bureau?
State meetings are later in February. Until then, I can answer any questions anybody happens to have. I don't have anything new until we have state meetings. It is the end of January, so please know that your controlled substance reports for the second half of 2024 are due if you haven't already submitted them.
There is a portal for that.
I have to say there is a portal for that, so please don't email them, put them in the portal, because if you email them, they will be returned to you to put in the portal.
You help the portal, help you. I'm quite versed in the portal.
What was
now.
Jared was just mentioning he's quite versed in the portal, so he can help anybody who needs to find that, or the submitting part's not the hard part, it's the finding the portal.
Listen, if I could talk Danielle Hopeful through it today and she submitted successfully, I can help anybody.
Nice.
Make sure that when you do submit to a portal, you are sent back a receipt. The receipt has an SID, a submission ID number on it. Please keep that receipt, because if there's any issue with your submission, you'll be asked what your SID number is. And if you have lost that submission number, we can't help you. So please don't lose the receipt that comes back from things, especially like CME, or I don't even know. I think you should get, you get one with your OPSERT renewals, you get one with your controlled substance renewals, you get one with your CME renewals. So anything like that comes back with a receipt, and on it is an SID, a submission receipt, a submission ID number. So therefore keep that, please, until everything comes back to you completed. So therefore, if you have any questions, you have that ID number to associate with your submission.
Melissa, I have one question. Where does the state stand with BLSFR certification and certification renewals?
Certification of BLSFR.
Yeah.
So licensure, which is Don Trepak and his group, took that over. We were doing, actually, Alex Kazar was doing that himself on top of his other duties the longest time, and they are just starting to get to them, so they are a bit behind. But in the next few months, you should be hearing from them with anything on that, and they will pick that back up again. They were going on time, and then they got lagged behind, but they're just starting to pick back up on those. So in the next couple of months, you should hear back on those.
Thank you.
If you have specific questions on a specific one, just email me or Vinnie Ouimet, and we can reach out to them for you and see where it is in the process.
Okay, thank you.
You're welcome.
Anybody have anything else for state? All right. County EMS reports. Al, anything from Hartford?
No.
Okay. Short and sweet. Jenna.
We met with our leaders on Monday, had a pretty good discussion. We had our agency agreements out for county funding. Which is that? There we go. But we did put those agreements out for county funding. And other than that, we're just working together as a group to make changes to the county plans.
Anybody have any questions for Jenna? Or Al, since I didn't give anybody an opportunity to ask Al questions? How much you feel left out?
Thanks.
All right. Notice your EMS coordinator's not here, so. Oh, it's an observation. That's all it is. Jim, Oneida County.
Yeah, just a couple things. One, I want to thank JJ for taking this purchasing group over with Boundary and stuff like that. We've had some meetings, and this has been something we've been discussing for a while. JJ took the helm on that. To be able to get this, I think it's overall going to benefit all three counties to get some better purchasing, pricing and stuff. Which I know we're going to get it out to all the other departments as well for fire as well as EMS. Radios are slowly getting out as far as programming them, so I know he's hoping to get those out to everybody at some point in the very near future. That do have the cellular Wi-Fi capability within those, so hopefully those will be coming up very shortly. I know there's been a number of agencies have gotten them and they've seen a lot of difference with those radios. As a number of people have said, we are having that meeting with the WIN on February 7th from 9 to 10:30. One of the things that we changed, and Oneida County is trying to collaborate with the WIN for this. One of the things we changed before is it used to be a roundtable, and talking to a lot of agencies, there was a lot of thinking it was just kumbaya. They just wanted to, serve some food and just talk about things. The WIN really wants to hear what's going on, what the problems are, and they are really want to get these fixed. But when we only have 4 or 5 people show up to these, it's really difficult to identify some of the issues. So it is something important that agencies show up and they want to hear what the issues are. They want to try to get back to, and I know a lot of you have been in EMS, back to the way it was before, where EMS and nursing worked hand in hand along with the physicians. They have had turnover, they do have agency staff, they recognize that, but they're very committed to try to work on this. They did see record numbers, I know, between the 3 of us going down there periodically trying to help. We've got 12 ambulances lined up and 3 and 4 hours holding. It is a challenge, and we're trying to mitigate some of that, but it's also something that when they're seeing some of the highest numbers that they've ever seen in that ER, it's very challenging, and we know that ER is being used as the urgent care. So we're trying to work on some of that. I know they're trying to get more education out there for some of that, but please come. We want to hear. We're going to try to work with the WIN to try to help some of these things, and that's why Jared and John and I have been really working to try to also help move things along with some of the staff down there. And we're working on some other things too to try to streamline some of the things. So hopefully next month I'll have some new policies that will also help alleviate some of our things. Some new policies. One of the ones that we're looking at to try to extend is the A&O calls, which we know are low priority. When this occurred, there's a couple other counties that do this, but they held those A&O calls indefinitely. We also did put them all to nurse navigation, which did result in more patients over to nurse navigation for those. Some of them did come back, but it did help us. But also holding those A&O calls until that home agency gets back in service instead of pulling in mutual aid for some very low priority calls and stuff like that. So we're looking at holding some of those indefinitely. It may be a new policy coming out once we get it all finalized, as well as a few other things. But, again, please come to the meeting. It's going to be important for all of us to hear so we can help resolve some of these issues, but also make it better. And really try to get some of that camaraderie back between the hospital and the agencies and stuff like that. And other than that, that's all I've got.
Question for Jim?
I do have a question. I already know where the 911 center's stance is, but what's the feasibility of us delaying ambulance response to MVA unknowns, especially with inclement weather? Where we're unavailable for more acute calls because we're chasing NBA unknowns. I'll take that back and
I agree.
Good idea.
talk to Fred and Ed about that. No, it's a very good question. I know it kind of becomes a point of contention with the fire departments aren't going to certain NBA unknowns. They're selecting which calls they respond to, so that kind of puts it back on the ambulance, but I think that should probably be revisited. Yeah, definitely. And I mean, I think even with the A's and O calls, that will go out to the fire departments because again, some of these may be held indefinitely, you know, up to an hour or longer. So fire departments are still going to these very low priority calls. They may be staying with the patient for a period of time where many of the agencies have chosen to not go to essentially ambulance only calls. So it is something that we're trying to get what the patient needs to their house, whether it's a rescue or it's an ambulance or both. We're really trying to work on that stuff with the departments and stuff to try to, number one, help a lot of the agencies make sure that they want to go and they're getting to the calls that they need to go to that are going to make a difference. But also that, you know, we've had some when they were holding, we're complaining, they're like, well, we're still waiting for an ambulance. Well, it's going to be a while. So, you know, it's going to be their choice. It was kind of the benefit of, an indirect benefit of having those calls penned. Correct, because it did free up ambulances for emergencies, and, you know, so. But no, I'll definitely take this back and I'll have a report back and I'll get it out to the agencies as well.
Any other questions? Okay. See, REMSCO and CMAC met in December. It's our first meeting since that, so the 2024 update on the EMS workforce shortage, where are the emergency medical responders document was officially released. It's available on Midstate's website. Bureau would like to remind agencies to make sure they're securing and locking their vehicles whenever possible. With the cold temperatures, make sure that your medication is temperature controlled. Any agency, this was put out by the director as well, any agency that is noted to be struggling, please let the Bureau know so they can try to help them with whatever they need. And the Surge Operations Center continues to operate, was what I mentioned. Bureau of Narcotic Enforcement, we already talked about that with the things. Let's see, the vehicle build specs are going out for public comment period early 2025. The equipment regs were already out for public comment. They came back and are going out for a second public comment period, again, early 2025. And the performance standards regulations are going out for public comment also early 2025. I don't really have a lot of detail on that. From CMAC, one of the things that came out was, and I forget what region it was, but they're looking at, it was passed by the CMAC and the SEMSCO, then sent to the commissioner for approval to begin a glucagon pilot program for EMTs. This will be similar to the IGEL pilot program that other agencies can sign on to this if they'd like to. But that's really all the information that I have on that right now. So as soon as the commissioner approves it and it goes, it starts growing legs from there, we'll know more about it. So hopefully in February, we'll know something more. Protocol updates will be coming out in July. 1 year EMT original pilot was approved by SEMSCO for 10 to 15 course sponsors to do portfolio based instead of traditional PSE. So this would be similar to the paramedic programs. They did not mention what 10 to 15 course sponsors are going to be involved in this, but they're looking to hopefully start this on or before July 1st. So more to follow from the core sponsors if they get approved. All right, page 2 I lost. Aha. Let's see, continuing to research recruitment retention initiatives. We still have those policy statements, 23-08 B, I think it was, had the policy statements for funding. So make sure that you can take advantage of those, do so. There were leadership classes that were conducted at Vital Signs. From what I'm told, those instructors are willing to travel to agencies if requested. So anyone that wishes to have some leadership classes for your agencies, we can reach out to the program agency. They can find out from the Bureau how to get that set up and make that happen. Still continuing to work on policy statement 0606. Some of the items that they're working on are currently with Division of Legal Affairs right now, so they're waiting to get that stuff back. So if everybody remembers, there was a discussion a while back about the extension for Medicare ambulance add-on funding to continue at the current rate. This was at the federal level. That did pass towards the end of December, so they have continued that funding. There are some state bills from 2024 that are expected to be renewed in 2025, but again, no dates. Some of these are in the governor's budget. S4020B, EMS and Essential Service. S7286 is the income tax credit to increase from $200 to $800. S6645 through emergency services permit to extend to EMS. S3223 to create a methodology for ambulance reimbursement under Medicaid that more closely approximates the cost of providing the service. S5000 and A4077 to remove EMS services from real property tax cap. And then S6630 to allow volunteer EMS and fire to receive both property tax and income tax credits. That's really all I got. Questions? So as was mentioned, the next REMSCO and CMAC meetings will be the end of February, so we'll have more to bring back to here in March. Any old business? Hearing none. Anybody have any new business?
Those are the dates.
Yeah. Okay. The only thing I have under new business is, so next month, the meeting is supposed to be February 25th. However, the 26th and 27th are when the state meetings are, that start bright and early in the morning. So, program agency has to be out there all day Tuesday for program agency meetings, well, in the afternoon part, so they wouldn't be here for the REMSCO meeting. I need to be out there for the SEMSCO meeting. So what I would like to know is if anybody would like to have a motion or make a motion to move the February REMSCO meeting 1 week ahead to February 19th.
It would be the 18th.
It would be the 18th.
Tuesday.
Thank you. So clarifying to February 18th.
I'll make that motion.
Second.
And if we can't make that meeting, we don't get dinged for this, right?
You shouldn't be, because it was a oddly scheduled meeting. You shouldn't be. You'll get counted as absent if you were to get some. Yeah.
That's when you got notified Dr. Black too. And we want to bring in
Any discussion on moving that date?
Yeah, I think I make a motion to move it to the 18th.
Okay, Jared already did.
Okay, I'll second. Okay.
So I guess there's a,
Time to go.
the motion's been called. All in favor?
Aye.
Any opposed? Okay, anything else for the good of the organization? All right, motion to adjourn, second, all in favor?
All right.
Everybody.